7 warning stroke signs in women that you should never ignore. In today's video, we're going to explore the key warning signs of a stroke specific to women, what you can do if you or someone you know experiences these symptoms, and the major risk factors that increase the chances of a stroke in women. Before we dive in, make sure to hit that subscribe button and help us reach our next milestone of 500 subscribers. Your support helps us continue to bring you valuable, life-saving health content. The danger of strokes in women. A stroke is a medical emergency, an attack on the brain that can lead to severe disability or even death if not treated immediately. What's especially frightening is that stroke symptoms in women can be subtle, easily mistaken for common health issues, left or even written off as stress. But make no mistake, strokes are one of the leading causes of death in women, and the signs can appear without warning. Immediate medical attention is crucial. When it comes to strokes, every second counts. The longer you wait, the greater the damage to your brain. Let's jump into the 7 warning signs of a stroke in women that you should never ignore. 7 warning stroke signs in women. 1. Sudden numbness or weakness in the face, arm, or leg, especially on one side. A stroke often causes a sudden loss of strength or feeling on one side of the body, particularly in the face, arm, or leg. For women, this symptom might appear in more subtle ways, like difficulty gripping objects or a slight droop in the face. This symptom could be mistaken for fatigue, but it's a clear sign something's wrong. Don't ignore it. 2. Sudden confusion or difficulty speaking. Struggling to find words or suddenly being unable to form coherent sentences is a major warning sign of a stroke. For women, this can be even harder to detect because many are quick to dismiss it as tiredness or emotional stress. But if you're suddenly having trouble understanding language or making yourself understood, this could be a sign that your brain isn't getting enough oxygen. 3. Sudden vision problems. Blurry or double vision, or even a sudden loss of vision in one or both eyes, can be a warning sign of a stroke. Many women think they're just tired or strained from staring at screens all day, but if your vision suddenly changes, it's essential to seek medical help immediately. 4. Trouble walking, loss of coordination, or dizziness. Strokes can affect your balance and coordination, making it hard to walk or even stand without feeling dizzy. If you suddenly feel like the room is spinning or you're stumbling for no reason, it's a big red flag, especially if paired with any of the other symptoms we've discussed. 5. Sudden severe headache. A stroke headache is often described as the worst headache of your life, coming on suddenly and without warning. For women, this can easily be confused with a migraine, but a stroke headache is different. It's sharp, intense, and doesn't go away with typical pain relief methods. 6. Sudden fatigue or nausea. Women, more than men, are likely to experience extreme fatigue or nausea when having a stroke. This isn't just feeling tired after a long day. It's a sudden, overwhelming exhaustion that you can't shake off. Paired with other stroke symptoms, it's a clear sign something is very wrong. 7. Hiccups and shortness of breath. One of the more unusual stroke symptoms seen in women is sudden hiccups or difficulty breathing. These signs can easily be mistaken for anxiety or indigestion, but if they appear alongside other stroke symptoms, you need to take action fast. Risk factors for stroke in women. 1. Age and hormonal changes. Menopause and stroke risk. After menopause, women's stroke risk increases due to the natural decline in estrogen, which protects blood vessels. The older a woman gets, the higher her chances of having a stroke. Pregnancy and postpartum stroke. The hormonal and bodily changes during pregnancy and immediately after childbirth can raise the risk of a stroke, especially in women with high blood pressure or preeclampsia. Birth control and hormone therapy. Oral contraceptives. Women on birth control pills, particularly those over 35 or who smoke, are at an increased risk of stroke due to blood clotting effects. Hormone replacement therapy, HRT. Women who use HRT to manage menopausal symptoms also face a higher risk of stroke. 3. High blood pressure, hypertension. The silent killer. High blood pressure is one of the leading causes of stroke in women, and many don't even know they have it. Managing your blood pressure through lifestyle changes and medication is crucial in preventing strokes. 4. Atrial fibrillation, irregular heartbeat. women with AFib are at a much higher risk of stroke. If you have a fluttering sensation in your chest or irregular heartbeats, seek medical attention. 5. Diabetes. Blood sugar control. Women with diabetes are at a significantly higher risk of stroke due to the long-term damage high blood sugar does to blood vessels. Controlling diabetes through diet, exercise, and medication is key to lowering stroke risk. 6. Smoking doubles the risk of stroke, especially in women who are also on birth control. Quitting smoking is one of the most effective ways to reduce your stroke risk. What you can do if you notice these signs. 1. Act fast. If you notice any of these signs, act fast. Here's what to look for. F. Face drooping. Is one side of the face drooping or numb? Ask the person to smile. A. Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? Speech difficulty. Is speech slurred, or is the person unable to speak or hard to understand? Ask them to repeat a simple sentence. Time to call 911. If you see any of these signs, even if they go away, call 911 immediately. Don't wait. Time lost is brain lost. 2. Preventative actions. Regular health screenings. 1. Regular health screenings. Monitoring your blood pressure, cholesterol, and blood sugar levels regularly is essential in determining your stroke risk. These are silent killers that can significantly increase your chances of having a stroke without showing any outward symptoms. Women, especially those over the age of 50 or those with a family history of stroke, should prioritize regular checkups to catch any abnormalities early. High blood pressure is often called the silent killer because it doesn't always cause noticeable symptoms, yet it's a major risk factor for stroke. Healthy lifestyle. Adopting a healthy lifestyle is one of the most powerful ways to prevent a stroke. Eating a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can help lower cholesterol and blood pressure, reducing stroke risk. Regular physical activity also plays a critical role in keeping your blood vessels healthy. Exercise improves circulation, controls blood sugar, and helps maintain a healthy weight, all of which are essential for stroke prevention. Avoiding smoking and limiting alcohol consumption are also important lifestyle changes that can drastically lower your stroke risk. If you smoke, quitting now could halve your risk of stroke in just a few years. 3. Know your family history. Your genetic history matters. If strokes run in your family, you may be at a higher risk, and this is especially important for women, as some genetic predispositions are more prevalent in females. Share your family history with your healthcare provider so they can make informed decisions on your health management. This knowledge can lead to more frequent monitoring or early interventions, which could be life-saving. 4. Stay prepared. Recognizing the signs of a stroke in yourself or someone else can make the difference between life and death. Keep the FAST acronym in mind. Face drooping, arm weakness, speech difficulty, and time to call 911. The faster you act, the better the outcome. Women are more likely to experience subtle signs like sudden fatigue or nausea, so don't wait to get help if something feels off. Knowing these signs is crucial, and being prepared to respond immediately can save lives. Why are women more susceptible to stroke? There are several factors that uniquely affect women and increase their stroke risk. For starters, women tend to live longer than men, and age is one of the most significant risk factors for stroke. As women get older, the chances of developing high blood pressure, atrial fibrillation, and other cardiovascular issues increase, all of which contribute to stroke risk. Hormonal changes also play a major role. After menopause, estrogen levels drop significantly, and estrogen has protective effects on blood vessels. This means that postmenopausal women are at a higher risk of stroke than younger women or men of the same age. Additionally, pregnancy-related complications like preeclampsia can lead to high blood pressure, putting women at a higher risk for stroke both during pregnancy and later in life. Women are also more likely to experience atypical stroke symptoms, which can make it harder to recognize and diagnose a stroke early. Symptoms like nausea, hiccups, or extreme fatigue may not immediately scream stroke to most people, and this delay in recognition can be deadly. That's why it's so important for women to be vigilant about their health, understand the risk factors, and not dismiss unusual symptoms. Another factor is that women tend to have higher rates of conditions like depression and anxiety, which are also associated with an increased risk of stroke. Mental health can affect physical health in profound ways, and this connection shouldn't be overlooked. So, to all the women watching, stay informed, take your health seriously, and be proactive in recognizing the signs of a stroke. The sooner you act, the better your chances of survival and recovery. Stay vigilant, stay informed, and most importantly, stay healthy. See you next time.